Good evening, and thank you for joining us for today's webinar. I just wanted to go over a couple housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask questions through audio, please note the Q&A function on your screen. If you have a question that is not addressed in the presentation, feel free to submit through the Q&A feature, and our presenter will try to address as many as possible at the end. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with the link once it's live. It is now my pleasure to introduce our presenter for the evening. Dr. Christopher Doherty is an ophthalmologist and sees patients at the Lake West Medical Building in Willoughby. His special medical interests include cataract surgery, diabetic eye disease, glaucoma, macular degeneration, and many others. I will now turn it over to him.
Thank you, Amanda. Appreciate it. So everyone here today is hopefully ready to discuss everything you want to know about diabetes in your eyes. I'm Dr. Chris Doherty with University Hospitals Lake Health Physician Group Ophthalmology Consultants in Willoughby. And we'll go ahead and move on to the slide. So as I said, we all know the topic, everything you want to know about diabetes in your eyes. I'm going to run through some of the things that we'll cover today. Number one, why does a diabetic need an eye exam? How does diabetes affect the eye? What are the treatments for eyes that do have diabetic disease? What can diabetics do to care for their eyes better? And at the end, to catch all, any other information that maybe we didn't cover in those previous sections. So let's start out with why does a diabetic need an eye exam? So I'm going to give you a scenario that I come across pretty frequently. It's usually once a day. I'll have a new patient in the office in front of me. I'll come in and introduce myself and I'll say to them, what brought you in to see me today? And most of the time, I get a response similar to, I'm not sure why I needed to see you. My primary care physician set this appointment up for me. I feel like my eyes are fine and I have no issues with my vision. And I think this is an excellent opportunity for me, not only to help prevent vision loss in my diabetic patients, but also just better care for diabetes and alter the course. I really, really relish this opportunity to help people because it's important. I break down the diabetic eye exam into two big purposes. First, I think the eye exam helps my colleagues, whether they're primary care physician, an endocrinologist, or other subspecialists, it helps them better care for diabetes elsewhere in the body. And the best way I can describe this when I'm talking to my patients in the office, diabetes is a vascular disease. High blood sugar hurts blood vessels. In particular, I think about blood vessels in the brain, strokes, blood vessels in the heart attacks and heart disease, blood vessels in the kidneys, and your blood vessels that feed the little nerves in your hands and your feet, causing neuropathy. High blood sugar hurts those blood vessels. And in a regular outpatient setting with your primary care physician or your specialist, they're going to monitor these areas with laboratory testing or imaging. Every diabetic knows about their hemoglobin A1C. And that's the main way that we're going to track and see how well the diabetes is taken care of. And that's like a 3-month snapshot. It's pretty good. Your eyes have the same blood vessels as anywhere else in your body, but I can physically dilate the eyes and look in and see diabetic changes as they're happening. This is unique. There's no other place in your body where we can look at these blood vessels with diabetes and know if things are going on. If the eyes are in trouble, it's a pretty good chance that other parts of the body are going to be in trouble too. And this is a chance for me to report back to your primary care or your endocrinologist and say, hey, I'm seeing eye changes. We need to double down. We need to get this diabetes under better control. When we look at the United States, there's a lot of need out there. About 35 million adults 18 years or older in the United States are diabetic. That's more than 1 out of 10 people. And there are some statistics that indicate that perhaps maybe half or 60% of these patients skip their examinations every year or don't have the examination done. So if we do a little bit of quick math here, so 35 million adults is 70 million eyes. If you take 60% of 70 million, that's 42 million eyes in the United States that should be checked that don't. And that's a huge, huge amount of eyes that we're missing. So going back to my previous slide, the two main purposes of the diabetic eye exam, number one, help my colleagues. Number two, we're going to catch or maybe even prevent diabetic changes in the eye. So we're going to focus right here. We're going to take a good look at those eyes. So that kind of springboards me into the next topic. So we're looking at the eyes. How does diabetes affect your eyes? So those vascular changes there, the blood vessels are irritated or damaged, and because of that, blood flow within the eye is reduced. You may have heard, other doctors mention this thing called diabetic retinopathy, and that's when you can see these physical changes going on inside the eye. And they follow a spectrum. Starts out with non-proliferative retinopathy, and then it progresses to proliferative retinopathy. And then from there, you can start to get these other bad players: neovascular glaucoma, retinal detachments, vitreous hemorrhage. And these are all, part of a spectrum. Non-proliferative, fancy way of saying new blood vessels aren't forming. Proliferative, new blood vessels are forming. And that's where you can really start to get in trouble. And then those other things, springboard off of those new blood vessels. We want to catch it when it's at that non-proliferative stage, or hopefully before there's any changes at all. The retina, it needs a lot of oxygen, and a lot of oxygen means you need blood flow. And without blood flow, it's not going to work properly. When I talk to my patients in the office, I tell them to think about their eye a little bit like a camera. It doesn't matter what lens is on the camera. If the film in the back of the camera is in bad shape, you're never going to get a nice picture. In the retina, where these diabetic retinopathy changes can happen, that's the film of the eye. The other way that we can see, significant changes is something called macular edema, or fancy word for swelling in the back of the eye. The retina can be getting good blood flow, but if those blood vessels that are irritated have little holes in them, you'll start to see fluid and liquid draining out. I've got a picture here. This is a scan that we do commonly in the office called an OCT. And don't worry about what that means, but it shows me the structure of the back of the eye and the macula. There's this little divot here, this little squished area. That's what you want to see. That's nice and flat. This is where 20/20 vision comes from, right in here. And you can see in this picture below how it's all swollen and filled with fluid. This person has leaky blood vessels, and because of that, that fluid from blood is building up and causing those layers to be swollen. And you can imagine that's pretty distorting to vision. Another common way that diabetes can affect the eye, and this might be what I see the most, is dry eye. Diabetes tends to dehydrate you, and the eyes are going to follow any other tissue in your body. If you're dehydrated from diabetes, your eyes are going to be dry too. You also have an internal lens in your eye, and that sits right behind your pupil. This is actually where cataracts form. But this can become swollen because of high blood sugar. It fills up with water. It becomes too big, and that's going to throw off the focus in the back of your eye. And you can also get cataract as well. Normally, this lens in the eye is clear and easy to see through. All this white, dusty stuff that you're seeing here, these fluffy white areas, that's actually cataract from diabetes. And you can imagine that's like looking through fog or smoky glass. Very, very disturbing to vision. So now that we know some of the ways that diabetes can affect the eye, what are treatments that are out there that can help these changes? Fortunately, some of these treatments are some of these changes in the eye are reversible without doing any treatment. All you need to do is just take better care of your blood sugars. I have a lot of folks that'll come into the office and they'll tell me, got diagnosed with diabetes a couple months ago, and my vision's been really blurry since. And what happened was they had a pair of glasses that were calibrated for their eyes when they had their diabetic changes. And as their sugar control is improved, their glasses numbers actually shift. So when I get a new person in the office with me, their blood sugar is running high, maybe their A1C is a 10 or an 11 or a 12, I'm going to wait to prescribe them glasses because I get the feeling once their sugar levels get better, they might find that either the old glasses they have work better, or maybe the numbers that we found that day weren't right to begin with. And some folks that get that non-proliferative diabetic retinopathy, maybe where they're just starting to show some signs that the blood vessels are irritated, even those can revert back if good blood sugar control can occur. For something simple like dry eye, I'll just have a person use lubrication. Putting artificial tears on the eyes every day is a good thing no matter what. Swing by the drugstore, pick up something that says artificial tears, lubricating drops, moisturizing drops, and pop them in the eyes a couple times a day. And even though for some folks it can be a little frustrating doing eye drops, I really feel like a little bit of lubrication for all my diabetics is a good idea. For that person that develops a diabetic cataract, sometimes we can watch them, but often this person might require cataract surgery earlier than they normally would. Cataract is something everyone's going to develop, but diabetic cataract can really push forward the timetable. Now, as these changes within the eye become more severe, close observation and getting the sugar down may not be adequate. There's laser treatments we have, and that sounds a lot scarier than it actually is. It's not Star Wars. We're not talking green and yellow lasers. But it's very effective, used more in the past than I think it is now. But still, overall very safe treatment and can do a good job of keeping diabetic changes from progressing and causing more trouble. For folks that develop glaucoma due to diabetic changes, eye drops like we would normally use for glaucoma or surgery like we could use for glaucoma are sometimes necessary. And there are instances where you might need medication injected directly into the eye. Just like laser treatment, that sounds terrible, and I wouldn't blame anyone for feeling that way, but it's very, very common, and these medications are highly effective. And in the worst case scenario, for a person that's developed, a retinal detachment or severe hemorrhage within the eye because of diabetes, you might need a retina surgery. So the treatments get more severe, with more severe diabetic changes. And that's why it's so important that we catch these things before they become a problem. Now, no matter what treatment we do, the most important thing, bar none, top of the list, is getting the sugar control. If we don't control the sugar, it doesn't matter what other treatments we're offering. Sugar control is paramount. It is the most important thing. Now, on a much more hopeful topic, what can a diabetic do every day, to care for their eyes better? Prevention. That is the number one thing. Go to your primary care physician or your nurse practitioner and think about all the things that they would normally tell you. Diet, exercise, smoking cessation. These are the kind of things that are going to keep the blood vessels in your body healthy overall. I do get a fair amount of folks asking me about multivitamins. Usually that's related to macular degeneration. They've heard about these vitamins that people will take that are healthy for the eyes. I don't think there's been any significant, studies that have shown that, there's a multivitamin formulation that, would be helpful for diabetic disease. In general, green leafy vegetables, foods with, a lot of, bright colors, carrots, peppers, good healthy foods in general are going to be good for your eyes and going to be good for your diabetes too. And like I've said before, remember, diabetes is a vascular disease. If it prevents a stroke, a heart attack, or kidney problems, then it's going to be good for your eyes too. And yes, that is me just a couple weeks ago running a half marathon. Had to plug that in there. I never used to be a good runner. This is something pretty new to me. If I can do it, anybody can do it. And boy, it's good for your health. And just in case I didn't mention this already, remember, diabetes is a vascular disease. So think about other things that are vascular. Number one, hypertension. high blood pressure and diabetes are common bedfellows, and where hypertension goes, diabetes tends to go. We've done studies, over large groups of patients, and we actually found that controlling blood pressure along with blood sugar together led to lower rates of diabetic changes. So it's not just enough to keep the sugar down, you got to try and control the blood pressure too. Now, with good risk factor control, diabetes, high blood pressure, there are still some folks that are going to develop changes. Those same studies have showed that poor sugar control and a greater length of time since diagnosis of your diabetes are associated with increased risk. That risk is usually starting to be most prevalent around 20 years of diabetes, but I've seen folks with diabetes for a year that have changes, and I've seen folks with diabetes for 35 years that don't have changes. So no two patients are alike. I would say, regardless, the best thing is just come in for that annual appointment. We don't know where folks fit into. We don't know, how good the sugar control was maybe for the first 5 years of diabetes versus these last 5 years. So make sure you come in for those annual appointments. That's going to be the best way. And always make sure you call. Whether you're seeing me or another ophthalmologist, if you notice a big change in your vision quickly or unusual eye symptoms, please call. We're always happy to see you, or take a phone call and discuss it and decide if you need to come in and see me today or okay to see me next week. But it's never a problem to call. If we're not answering your questions or covering what's important to you, bring it up. Let us know. So that pretty much wraps things up in terms of what I wanted to cover today. So now is an opportunity for you guys to ask me some questions back, because if you haven't noticed as I've been talking today, a lot of this is about the things that folks ask me. So here's your opportunity. You've got an ophthalmologist sitting here, and I'd be happy to answer any questions about diabetes and your eyes. Thank you so much. It's been a pleasure talking with you, and like I said, I hopefully get a good opportunity to answer some questions here. And I'll turn things over to my collaborator, Amanda.
Okay, if anyone has any questions, feel free to type them in the Q&A box. Okay, our first attendee asks, is there any relation between diabetes and macular degeneration?
So as far as I know, no, there's no specific correlation between diabetes and macular degeneration. The big thing to keep in mind, though, is you're talking about two things that can affect the same eye in the same place. Both diabetes and macular degeneration can hurt your macula. So if I have a patient come into the office who has macular degeneration, and they're also a diabetic, I'm going to watch them a lot more closely, and I'm going to take any changes they have much more seriously. In general, just like diabetes, macular degeneration is something where smoking cessation is going to be paramount. Those two things together, are a bad combination. So macular degeneration and smoking, make sure you stop smoking. And just in general, for your overall health, stop smoking too.
Okay, our next question is, if you are diagnosed with type 2 diabetes, when should you begin eye exams and how often should you return?
So if you were just diagnosed with type 2 diabetes, you should be seeing me within the first couple months of diagnosis. In general, I recommend yearly checkups. Now, if you do start to show some signs of diabetic changes in the eye, we're going to push that schedule up. More mild changes, maybe see you every 6 to 9 months initially. Anything more severe, we're going to be following you closer than that. And, potentially, every month if treatment is needed.
Okay, the next question kind of follows that one. This one says, my prior ophthalmologist had me on a quarterly appointment schedule. What would be the driver for that frequency? So
at least in my practice, folks that I'm seeing quarterly, that usually tends to be for another condition called glaucoma. If I had a diabetic with macular edema or more severe diabetic changes, but I didn't feel like they needed to see a retina surgeon or get treatment yet, I might see them, every 3 to 4 months. But there's not many cases with diabetes where I'm going to be going that frequently. At that point, you'll usually be seeing a retina specialist.
Okay, our next question is, if I already have had laser surgery and injections to stop the bleeding in my eyes, but I'm still having breakthrough bleeding, what is my next option?
That's tough. It all depends on what kind of injections you've got. These medications that go into the eye, there's a couple different varieties. Sometimes we'll use steroids, but that's usually more for the macular edema side. If you're having frank bleeding like vitreous hemorrhage, laser is usually the best treatment. At that point, that's going to be up to your retina surgeon if they feel like you would need an intraocular procedure within the eye. And it may be possible you might need more laser as well too. Sometimes we'll do just the bare amount of laser we need to get the treatment effect we're looking for, and leave extra space in case we have to do more. Lasers, it's a little bit of a destructive process. What you're doing is you're trying to take those areas of the retina that you don't use, that are getting poor blood flow in, and knock them out. That's kind of a crass way of saying it, but that's probably the most direct too. So a lot of times doctors will leave extra space, to do more laser down the road. So that would be my next thought. You might need more laser, or potentially switch to a different class of medication.
Okay, the next question is, does a person with hypothyroid disease have a high risk of diabetes?
In terms of hypothyroid and diabetes, the interrelationship, you're talking about two, endocrine processes. I'm sure there's combinations of thyroid disease and diabetes, but just garden variety hypothyroid and diabetes, no, I don't believe there's any specific association.
The next question is there anything you can do if you have already lost most of your sight due to glaucoma?
Unfortunately, no, there's not. Glaucoma, I think in the past was always taught as a disease of high eye pressure. But more recently, we've started to think about it differently. Glaucoma truly is a disease of the optic nerve in the eye. And just like your brain when you have a stroke, or your heart when you have a heart attack, if that tissue's been damaged, it's unfortunately damaged forever. That's not going to come back. If you've already lost significant sight due to glaucoma, I always counsel my patients, this isn't something that's going to get better. You need to make sure you continue to manage the risk factors of glaucoma adequately to prevent any further vision loss. And of course, get someone to a glaucoma subspecialist if surgery or any more significant treatment needed.
Okay, our next question is, what is the best vitamin for your eyes for a person with diabetes?
I'd say just a good multivitamin in general. And of course, always make sure, you discuss any of your supplements or medications, with your primary care physician before starting. But a good old-fashioned multivitamin is great. And like I mentioned before, green leafy vegetables, foods that have, are high in antioxidants, carrots, red peppers, things that have bright colors. They're always great for you.
Okay, our next one is, I am told I have a hole in my retina. What can be done about it?
That depends on the type of hole that you have in your retina. If it's a hole from a retinal tear or break, that might require a laser surgery to stop that from progressing. If it's a macular hole, it depends on the size and how symptomatic you are. Most of the time, though, anything structural like that with the eye is going to require some kind of surgical intervention to fix properly.
Okay, our next question is, are you accepting new patients and do I need a referral to see you?
I am accepting new patients. Referral is another story. That'll often depend on your insurance provider. It's always best policy, before setting up an appointment with a new doctor, to check with your insurance first and make sure that we're in network. But if it's good with your insurance, please give me a call. I'd be happy to see you.
Okay, are there any more questions from the audience? All right, I think that might be it.
Thank you,
Well,
everybody.
Thank you, Dr. Doherty, for your time and sharing this information and answering all these great questions from our audience. I just wanted to give our attendees a couple of reminders. We will email you a link to view this session on our website once the recording is posted. To schedule an appointment with a UH provider near you, please call 216-541-1149. This concludes today's session. Thank you for attending and have a good night.